Okay, so you are dispatched to a 67-year-old female complaining of chest discomfort and shortness of breath at home.
Okay. PP on is my scene safe.
Scene is safe.
Okay. So this is gonna be a nature of illness since she's complaining of shortness of breath. I would request additional ALS, and there's only one patient. Also, I would consider a C-spine. Can I get the general impression of my patient, please?
You find your patient sitting upright on her couch, leaning forward slightly. She appears anxious, pale, and is breathing faster than normal. She's clutching the center of her chest.
Okay. Hello, ma'am. My name is Layla, and I'm an EMS here. Do you know your name?
Yes, Eleni.
Melanie. Okay. Do you know where you're at?
Salinas.
Okay. Do you know what year it is?
2026.
And do you know why you called?
My chest is just hurting and I can't really breathe.
Okay. So we're gonna assess her breathing. My patient's airway is patent, and I am gonna go ahead and get an SPO monitor on her to get that oxygen.
It is 93%.
93%. Okay, so I'm gonna get her started on a nasal cannula since her oxygen is just a little low. I'll get her started at 2 of oxygen. We're gonna put this in your hand, sorry. Okay. After I'm gonna assess for her circulation. Can I your wrist, please? Okay, so how's the pulse?
Pulse is present and regular.
Okay, and then how are the skin signs?
Cool, pale, cool, and diaphoretic.
So we're gonna go ahead and do code 3 transport, and on our way to the hospital, I'm gonna go ahead and take OPQRST sample, and I'm gonna also ask for some vitals. Okay, so did this pain start suddenly, or did this happen over
About
time?
30 minutes ago.
30 minutes ago? Is there anything that makes it worse or better?
Just me moving around makes it worse, but sitting up helps it a little bit.
Okay, so how does the pain feel?
It feels like a heavy pressure, like somebody's sitting on my chest.
Does this pain radiate anywhere on your body?
Just to my left arm and my jaw.
Okay, left arm and jaw. From a scale from 0 to 10, how bad is this pain?
An 8.
Okay, and around what time did this begin?
About 30 minutes ago, but it's been constant.
Okay, so I'm gonna ask you a few more questions. Are you allergic to any medication, any food?
Penicillin.
Penicillin? Okay, is there any medication that you take or that you've taken in the past 24 hours?
I've had aspirin today. I'm supposed to be taking nitroglycerin as well as lisinopril and atrovastrin.
Thank you.
And what was the medication you took in the morning?
Aspirin.
Okay. How much of aspirin did you take?
181 milligrams.
Did you take baby aspirin?
Yes.
Okay. And then, do you have any surgeries that I should be aware of?
I've had a previous heart attack with as well as high cholesterol and hypertension.
How long ago did you have the heart attack?
4 years ago.
Okay. What was the last thing you ate?
A sandwich and water about 2 hours ago.
Okay. And what were you doing?
I was carrying my laundry upstairs when this pain started happening.
Okay. So since the patient has explained to me that she took aspirin early in the morning, how long ago did you take the aspirin?
I don't remember.
Okay. So she took aspirin. We are gonna help her administer the nitro, but since we don't know how long ago she took the aspirin, I should just give
Yeah,
it to
you
her?
administered both.
Although she took aspirin already, I'm gonna help administer aspirin and nitro. Do you have your nitro bottle with you?
Yes.
Okay. So this nitro is not cloudy, not expired. Seems to be good to use. So we'll help her take her 0.4 grams of nitro. That would be sublingual. So can you just put it underneath your tongue, please? And I'll go ahead and give her one big aspirin, which is 325 grams of milligrams of aspirin. She'll take that and she'll chew that on there. Okay, so now that we administer that, I'm gonna go ahead and take vitals. Can I get vital signs, blood pressure, respiratory rate, pulse, and blood glucose, please.
My blood pressure is 162/94. My pulse is 104, and respiration's 24. Blood glucose 119.
119?
18.
118. Okay. So I'm gonna reassess my patient every 5 minutes, and now I'm gonna hand off my patient to the hospital. So I have a 67-year-old female complaining of shortness of breath and anxious. I helped with administering nitro, and I also administered a full thing of aspirin. She's also allergic to, she's not allergic, she's allergic to penicillin, and she takes aspirin, nitro, lisinopril, and lisinopril. And her blood pressure is at 162/94, her pulse rate at 104. Her